Today we are talking about a topic that if you have hypertension, you need to pay close attention to today's topic. Do you or a loved one suffer from shortness of breath? Or do you get swellings in your legs, in your ankles, in your feet? How about when you sleep at night? Do you have to prop yourself up with a lot of pillows for you to be able to breathe well while sleeping? Do you sometimes have to sleep sitting up in a chair in order to breathe well? If so, you might have a condition called congestive heart failure. Let's talk about it. In this video, I'll talk about congestive heart failure, the causes, the warning signs and symptoms, and also the treatments. Congestive heart failure is a condition where the heart does not pump well enough in order to move blood around the body the way it should. Heart failure does not mean that the heart has stopped working. What it means is that the heart is working less efficiently, not as efficient as it should. So what are the signs and the symptoms to watch out for? Number one on the list is congested lungs. What this means is that there is a backup of fluid in the lungs. So there is difficulty breathing while doing any kind of exercise or even while at rest. This congestion in the lungs can also cause difficulty breathing while lying in bed, and also some kind of cough like a wheezing, hacking cough. There's also fluid and water retention causing swollen legs, swollen ankles, swollen abdomen, and also there are cases of bloating and loss of appetite, nausea, and so on. Because less blood is getting to the organs and muscles, there is weakness, there is tiredness, there's fatigue, and also because less blood is getting to the brain, the person feels confused, there is dizziness. So what exactly causes heart failure? Heart failure is caused by many conditions that damage the muscles of the heart. First on the list is coronary artery disease. The arteries carry blood and oxygen to the heart, but in this condition the arteries are narrowed, so there is less blood and nutrients reaching the heart. With the blocked arteries, the heart becomes starved of oxygen and nutrients. Heart failure can be caused by conditions that overwork the heart. Conditions like hypertension, which is high blood pressure, kidney disease, thyroid disease, valve disease, diabetes, and so on. It's very important you know that the goal of treatment for heart failure is basically to improve quality of life, to ease the symptoms, and to prevent it from getting worse. To effectively treat congestive heart failure, we have to look at pharmaceutical treatments and nutraceutical supplementation. There are various medicines that are used to treat congestive heart failure, but the best and the latest right now that is used by top cardiologists is the quad therapy. The quad therapy is a combination of 4 different types of drugs. Studies show that with this combination, you will get a 62% reduction in cardiovascular death or hospitalization risk. Some nutraceuticals have also been shown in various studies to help improve the function of the heart. They are ubiquinol and tocotrienols, the natural form of vitamin E. Vitamin E is one of the most important vitamins for not just the health of your arteries, that means the blood vessels, but also for the muscles of the heart. In fact, when you are low in vitamin E, your heart has to work much harder. Also important is vitamin D3 and K2. There are many other natural products that can be used to strengthen the heart. How can you prevent heart failure from getting worse? Follow these 7 steps. Number 1, keep your blood pressure under check. Keep it well controlled so that your heart can pump effectively without added stress. Number 2, monitor your symptoms. If you notice any abnormal or increased swelling, call your doctor immediately. Number 3, limit fluid intake to less than 2 liters per day. This will help reduce the workload of your heart. Number 4, cut down on the amount of salt you eat. This will help reduce fluid retention and you will have less swelling. Number 5, monitor your weight and lose weight if needed. Number 6, it's important that you take your medications as prescribed, not when you feel like. Number 7, schedule regular appointments with your cardiologist because congestive heart failure is a serious diagnosis. You must be closely monitored. Please share this video with someone you care about, and if you have not subscribed, please do. Thank you for watching. I'll see you in the next video.